Thanks for being with me today. Today we've got really an exciting show. I've got Sarah Hoit, and Sarah is a co-founder and chairman of the Social Impact Partners and the founder and CEO of Everyday Matters. Sarah Hoit is a social entrepreneur, an executive, a consultant, and a healthy aging expert who has made significant contributions in both the private and public sectors regarding social impact, technology, brain health, food as medicine, senior living, and national service. Sarah, thank you so much for being with me today. It's such a pleasure to have you.
It's such a pleasure to be here, and I'd be remiss if I didn't thank you for your extraordinary work in this space. So I'm excited for our conversation together.
Well, it's so nice to talk with somebody that when I say, I envision a brain lab in every office, in a grocery store. You go to a drugstore and they check your blood pressure. Why can't you go to the grocery store and go in a little brain lab and figure out, do a check-in? How's your brain working? And it's just a technology that's there now that makes this possible. So it's so great when I can say that and someone doesn't go, huh? What is she talking about? I mean, I know you can imagine a world where the financial burden of brain health issues like anxiety, depression, ADHD, and autism no longer cost employers over 300 billion annually. And it's not a dream, it's reality with people like you out there working to make it happen. So tell me a little bit about how your journey started.
Oh, well, thank you. Thank you so much. I think there's so much for us to talk about, and you and I, we know the numbers, we know the science, we've got so much to address, such possibility. But I think for all of us, there is a personal story, and it's not just my story, it's everyone's story. The one thing we know about brain health and dementia and mental health is that the numbers are wildly underreported. I don't know any family who hasn't been profoundly impacted. And certainly post-pandemic, the entire world knows this is the number one health crisis that we face. It is our moonshot moment. I I began actually as a technology CEO. I've been a social impact entrepreneur my whole life. I actually started a company back in 2007 to connect an aging population because I watched the horrific situation we were in with my grandmother, who was my role model in life, who was facing a long battle with Alzheimer's. We were having trouble connecting. We were having trouble communicating. We were having trouble accessing information. We had no window in, and it struck me that we really needed a technology intervention, that every family needs a way to connect and to communicate and to inspire and to live and to be together. And so we started Connected Living, and to try to address the isolation, to try to bring education and meaningful connection to an aging population. And so I built this company, and we were working with hundreds and thousands of families. It's actually now in about 7,000 senior living properties. And I watched my grandmother be able to have a little bit more connection. It was the end of her journey when we were starting the company. But as you know, my story gets deeper. 5 years into starting the company, and my children were only about 15 and 16 years old, actually maybe even younger. We learned that my husband had early onset dementia. At the time, they thought Alzheimer's. And so there we were, and there I was serving on boards and working very hard and as my company to help all these families. And next thing we knew, it was our household, and it was a very young, vibrant man. A very young, vibrant man who so often in this disease, and I know I speak for many, wanted to keep it silent. He didn't want me to tell the kids. He didn't want me to tell his family. He didn't want me to tell anyone. It was our secret. And I would have to call and remind him to pick up the kids after school. I worried every moment when I left the house. And so as much as you know very little when it's your own family. We faced a very long and challenging 10-year situation with him. We actually lost him 2 years ago tomorrow to the disease. And the last 4 years, eventually we had to tell the kids they already knew something was wrong. You're not hiding anything from anyone. And we went through all those moments. He had about 4 words left for the last 4 years of his life. He did not want to be part of the science and trying to solve it. We were in the middle of COVID, and so it was incredibly challenging. And we faced what every family faces, that moment where you need to take away the car keys, and it's really hard. You go from a partner, the love of my life, the man, that the great father and friend, to somebody's caregiver and almost mother status, where you're taking the things away that have meaning to them. So to say that we understand this disease with every fiber of our being is an understatement for me and my family, and I know it is for so many. And as a result of our journey and our deep love of this very special man, as I know as I'm talking, everyone has their story. My children and I started, together with many leaders in the industry, a nonprofit organization called Social Impact Partners, which is a global brain health and longevity initiative. And it's driven, I think the only choice we can either get lost in our pain, or we can turn our 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 pain into passion and action. And that's what we've decided to do. And I know what you have decided to do, and many other leaders in the industry. So that's a small piece of a long story, and obviously much to share.
Well, it's so interesting to me because research comes out, and I had a client come in my office and say, Leigh, have you seen the latest research on dementia? And luckily, I could say, yes, I have.
I have.
And he said, I'm so concerned now to see that vision loss and high LDLs are a factor that can contribute to dementia. And it's when you look at the other 12 factors there are, so many of them are involved in our lifestyle choices, and that scares people. But at the same time, I find it very exciting because we're learning enough to know that there are things that we can do, not for everything, but there are things that we can start to do to prevent dementia and to prevent Alzheimer's. And since we live to be over 100 these days, to me, it's exciting to see the good and the positive that research is showing us.
I want that to be the message. We have lived in a world in which there's been nothing but bad news. There's been no solutions. It's the only major killer for which there's no cure. There's so little known that even in my husband's case, everyone thought it was Alzheimer's. And the only reason we, in the end, had the answers is we donated his brain to research, which he agreed to. And he had Lewy body and frontal temporal dementia, not a single plaque or tangle. We know so little, and we cannot cure this disease until we actually have the science and the information and the investment and the collaboration and the willpower, which we do globally, to solve this. But as you said, there is hope. And what people need to know, the things, I'm sure, like you, it's a reason I started Everyday Matters. It's the reason I started the global nonprofit. I had sold my company during the pandemic as I was losing my husband and needed to focus on his care. And the great news is that science shows us, that it's estimated that only 25% of our health status is defined by our genetic makeup. Well, that is really good news for my kids and for everyone in my family, because not only my husband, but his brother and his father and many others, as we know with Alzheimer's, and clearly with Lewy body and frontal temporal, there are genetic ties, particularly with early onset. But the super hopeful news is that 75 up to 80% of our outcomes are what we do every day. It's called epigenetics. And so this is the hopeful piece. This is what we're working on alongside the science. If we know, which we do, that what we put in our bodies, that the food we eat, that our sleep, that our rest, that our exercise, we were not meant to sit all day long. These things are all pieces that we can work on, that we all have control over. We need to change how we work, how we study, how we live, how we train each other to actually bring out the best. We can have long, healthy lives. And as you know, we have figured out in this country how to live longer, but we have not figured out how to live better. And nobody wants to be alive without the access to their brain. The rest of our body is here to keep our brain warm. And so, and all these conditions are related. And so we can talk about some of these in the areas of work that we are deeply working on, and that it's important for everyone to know, and also not to just focus on our elders. Clearly, the conditions are building for years. By the time we see actual signs, it's been building for 30, 40 years. You and I know this, but this is birth to death. This is in utero, first 1,000 days of a baby's life. This is what we do every day. And anywhere along our journey, when we decide to make a difference, we can change it. We can change it for ourselves. We can change it for the people we love. We can change it for our children and our parents, and we can change it for our companies. People spend 80% of their time at work, and I know this is something you and I are focused on. The workforce has changed. The pandemic changed everything. And if people haven't caught up and aren't going to take advantage of what it means to have a newer workplace, they're not going to have staff. And so, and the productivity of their staff and the mental health of their staff and the health of their staff is profound in terms of economic consequences and obviously the health consequences that you and I care so much about.
Well, it's so amazing, though. I did a radio show a couple of weeks ago about how some schools are bringing in meditation. And I said, oh, this brings me such joy to talk about this because we're actually starting to teach coping skills. And yes, everything else they learn at school is equally important. But when you have 1 out of 4 children experiencing a mental health issue, whether it's anxiety or depression, and there's nothing that the schools have been able to offer. I mean, yes, there's school counselors and they're, God bless them, but there's maybe 2 to serve 500 students. And for a child to go in and go into the meditation room and listen to the chimes and focus on your breathing, I think that is the start. And I think that is the start of what, if it starts with the kids, it is birth to death. It truly is. You know, you mentioned something that I know is very near and dear to your heart, and that is food is medicine. And I can't tell you how many times I say to clients, the old saying, you are what you eat. And it's as simple as it is. It's really hard. And there's a lot of cultural associations with that. But share with our audience a little bit about how you're approaching food as medicine.
Well, there are a number of really exciting things that we're doing through our nonprofit, and work in several different, very large buckets where we can deeply affect change across the board, combining. And one of the things that we're doing just as a structure in the nonprofit is focused on, it's very entrepreneurial, on collaboration. We have to collaborate, and we cannot work in isolation. We have to innovate, we have to educate, and then we have to invest. As you and I know, we have to pour money into this, and we need all 4 of those pieces. We have developed several large tracks of work, and answering the question on food as medicine, it's one of the big tracks. Let me maybe describe for a minute some of the exciting work that's happening, because when we're listening to this podcast, everybody can get involved. This is all of us. This is the nonprofits. This is the for-profits. This is the scientists. This is the legislators. This is the youth. There is youth engagement. One of my first big rollouts of my career was AmeriCorps. I believe in youth movements. I believe in getting out of our own way and asking a younger generation to help us. And we know, Leigh, that people aren't coming. The young people aren't coming right now into healthcare. We have to excite them and ask them to be change agents and innovators and work beside us. So we have created these brain health innovation Olympics that we're doing globally, that universities, undergraduates, medical schools, engineering schools, business schools, we've had students from 13 countries taking part. But as excitingly, we have the scientists. I know you're joining us this year. We have the major corporations. We have the nonprofits. It's a space they can all come together. We have the major technology companies. And one of the big topics, there's several things that I believe are our most actionable areas. One that has risen to the top is food. If we're lucky, we eat 3 times a day. We know one major thing we need to address is health equity. For those who don't eat 3 times a day, and what they have access to does not have the nutrients they need to feed their body, their brain, their heart, the epidemic of obesity. We can solve this, and it's catastrophic. And we know inflammation in our body is also inflammation in our brain. And inflammation in our brain does all of the things that we don't need, and is the root cause of so many of the conditions that we face, whether it is Parkinson's or Alzheimer's or dementia or you name it. Inflammation is bad. So let's take hold of a very big topic. It's very actionable that we can try to change. And so we need to change it in several ways. One, give people access. What is the food that matters? What is the food that's better to us? Don't make it a punishment. Let's not even call it a diet. I know we say food is medicine, kind of like food-centered health or something positive, because the thing is, it's not a punishment. You and I know when you eat well and you have access to the amazing fruits and vegetables and healthy proteins and nuts, you feel good. It tastes good. You perform better. Your brain performs better. Your body performs better. Psychologically, you're happier. And so we have to change a dynamic. We have to make it not a punishment. We have to get the information out there. And obviously, we have a significant amount to do, which we are working on legislatively and otherwise, to get these types of foods to people in poverty who do not have access. And it is no mistake that in those marketplaces, diseases are fourfold across the board. So one of the things we're doing, there's some amazing players who are stepping to the table with us, just as a table, no pun intended, as incredible contributors to these Innovation Olympics that then are turning into legislative and strategy meetings with the ideas that the youth come up to. We are adopting, we are moving forward, we are coaching them. They are starting new organizations, but we're also infusing major companies with these strategies. I'll give you an example. We have a global leader, one of the world's largest food service companies, Sodexo, who serves 100 million people in 54 countries. They have been a sponsor and a judge and a participant up to the highest levels of their company: chief revenue officers, chief strategy officers, chief communication officers. And the 2 winning plans the first year of our Innovation Olympics were food as medicine plans. And guess what? They're listening. They're changing their language. They're changing how they look at this. They're looking at a global strategy that will embrace this. We are working on a global white paper on nutrition in the brain. They feed many people every day. Where do we start? What can we do? How can we take the knowledge that we have, communicate it to people so they understand the choices they're making and why? And then how can we also work together with legislators and payers? It's a big piece of the movement. It's happening. There are others working on this so that we can get the food to people and people can afford to have healthy food. So another example beyond Sodexo, who is going to change right now from the simple work we have done over the last 2 years, it's going to change the trajectory potentially for millions of people. We are actually going to be releasing that white paper in November in Paris. Kind of fun with the Olympics having just been there. But then we go to DC and we are working with legislators and others who care about food as medicine, who care about strategic plans on aging, who care. We know we need to get the money there. Just look at healthcare costs. If we can just kind of bring to the numbers, because numbers actually usually make people pay attention, both corporations and governments. 85% of all healthcare spending is related to the management of diet-related chronic diseases. And again, you and I know they're all attached. If you're obese and you have diabetes, your brain health situation is going to be in a much more dire situation. 13.6 billion could be saved each year if all eligible Americans received medically tailored meals or interventions. This is starting. There's amazing companies like Instacart and Kroger and others. Kroger is now rating your basket if you want, to tell you what's in it and how you're doing and how you can do better. We, as part of our global nonprofit, have partnered with the Future of Commerce Initiative. I know you're coming. You're now a part of all of this. You need to be speaking beside me. We are working with these major companies and food service companies to say, okay, we have a stake in this and we can really do something. And so it's happening, and we're collaborating, we're talking, we're working with the scientists and moving pieces forward that can be done and trying to get the payers at the table as well. So these are the things we can do. That's in the education and collaboration bucket. We meet at Harvard. Any major corporation hearing this, please talk about joining us. We have the who's going to be at the table, the major brands, the major food companies, the largest in the world. And why not start big? Because if we start big, it will actually change millions of lives, and not just for our consumers, but as you and I know, for our employees as well. And the other interesting thing is now there are programs where there's a program that provided 10 medically tailored meals for an average of 9 months a year to adults with serious medical conditions. And it resulted in a 16% reduction in healthcare costs already. We have these examples. It is not pie in the sky. But as you and I know, we are just getting started. So one other amazing outcome of our little nonprofit here, this consortium of bandits who've come together, of major players from all over the world, we're going to be doing some pragmatic clinical trials. About 6 or 7 of the judges and participants last year, the scientists, the technology companies, the food companies, the senior living companies. As we know, everybody in senior living is on some path of brain health and dementia, either have it or worried about it. The family members are as well. And we are going to be doing some pragmatic trials that we're raising investment for. So all these things are tied in. It is this rolling snowball, and these types of actions that everybody can get involved in, whether they want to show up with their corporation, they want more information for their family, their youth want to get engaged in the Olympics and be a part of it and bring it back to their schools and to all the people they know. This is a movement, and the movement also has to be fueled by the younger generation. So I know that's a lot, but food is one of the big areas that we really, really are diving deep and can take action. And there are others we can discuss as well.
Well, and food is so hard for the younger population. That is if we get them involved and we get them educated and they understand because when your mother says you are what you eat, you just, that's your mother. But when you get involved and you see results and you see how eating good food can make a difference, because those are our change agents. They're the ones that are going to carry it forward.
They are. And we have a youth board. So any of the young people hearing this, they help run this organization. We have young people from 13 countries, over 100 have participated, and we want to blow that up. Our next Olympics starts on September 30th this year. And it is very exciting. And it is their voices and their change agent status, either to bring it to their organizations and the schools where they are studying, to bring it into their new careers and jobs and get recruited, as all of these participants are. I mean, you listen to these young people, and the companies who show up to support the Olympics and be judging and be the action agents like the ones I mentioned are hiring them. Or we've had a number of young people actually start companies. Let's talk about another big topic, sleep. Sleep is significant. And all of the young people who are involved in this are changing what they're doing when they hear that we need 7 to 8 hours of sleep to get not only to the REM, but to the deep sleep, which you and I know is the only time that the microglia can clean the junk out of our brain. And that's every day. And it matters. And we can't go back and get it. So I've now told my amazing daughter and son who work their tails off and used to pull the all-nighters, and guys, if you're going to be up until 2 in the morning writing that paper and doing your amazing stuff, I'm sorry, maybe I'm a good mom, maybe I'm the worst mom in the world, sleep in and miss your first class, because actually your sleep is going to be more important for your future and for your brain. So if you needed to stay up and do that amazing thing you were doing, then sleep. And these are choices and trade-offs. I didn't know that. I pulled so many all-nighters, and I wouldn't have. I've got the Oura Ring. I focus on the technology. I'm a tech CEO. I have the watch, I have the ring. I now can track my sleep and how many times I wake up. And I didn't know this, my heart rate while I'm sleeping. These are really, really critical factors that we can control. Our exercise. I now put this into my calendar when I say to somebody, work harder than the next person, right? I mean, there's no end to the day, but I work my exercise in. We can't sit here all day. If I'm going for a walk or a run, it can be a walking meeting, or I'm busy. I'm just as busy if I were on the phone with you, because that hour of exercise and that breathing and that movement does everything. The endorphins and what happens to our brain when we are happy and exercising versus when we are stressed and sedentary is profound. So these are small things, but they are incredibly significant in our long-term health and outcome, and something we can do together. I say to my team in work, if we don't have to be sitting in front of a computer, I know we're all used to looking at each other now on Zoom, let's have a walking meeting. We're always more productive. We always come up with more ideas. We're moving and our blood's flowing. And so there's different ways of thinking about these really profound pieces of our day that aren't that hard to change if we just know how important they are. And then we as leaders, we as parents, we as educators, we as scientists, whoever we are, whatever superpower and sphere we influence, then let's help those around us feel good about making those choices and serving them that food.
Well, and I think that you've touched on, and you touched on it earlier, here's the missing part, and it's called self-care. And as mothers, we take care of everybody else. We don't take care of ourselves. As leaders, we'll make sure that everything gets done that needs to be done. What about you? What about your time to exercise? Have you gone to the wellness room? Have you sat down? Have you closed your eyes? Have you tried to practice your breathing for
Some
five
deep
minutes?
breaths. Yes.
Yeah. So
Profound.
for it, there's so much out there. And I think, that I encourage all of our listeners to go to the Social Impact SIP and Social Impact Partners and download the 2024 Impact Report, because you can learn so much more about your brain health and longevity and what you can do. I mean, who out there as a listener doesn't want to lead a long and healthy life where your brain is just working as hard as it ever has?
Well, and as you said, everybody, this is a place everyone can come. If you go to www.socialimpact.partners, people can be individual members, they can be student members, they can be corporate members, they can be judges and sponsors of the Olympics, they can come to our Harvard Faculty Club sessions with major corporations and the Future of Commerce Initiative and Harvard Business School professors and drive real strategy that will change the economics of their company and the impact in the world. We have so many ways we can play, and we do go do legislative sessions in DC. We work with our legislators. They do have really important pieces in this. There's significant federal dollars, many of which are not being used because people don't even know about them, with some of the food support and other pieces of this. So I think that we are early days, but we are powerful. We are stronger together. We are hopeful. We are impassioned. This is fun, and it's something we all do together. And wherever you are in your life, whether you're the employer looking for great talent, whether you're the student looking for your passionate career where you can be a change agent, whether you are the mother, father, sister, brother, daughter who has someone, which we all do in our family, who is suffering from something. The mental health crisis is catastrophic. The costs are catastrophic. The dementia crisis is catastrophic. They are all linked. And all of them, the pieces that we talk about with the pillars of brain health, impact everybody so positively. One other really exciting piece, and sometimes things that are new are looked at as the boogeyman, but technology, AI, data, we are in one of the most transformational moments in business. Everything is going to change because of that. And we have the chance to, okay, it's here. We know there's dangers. We have to protect against the dangers. Let's put that in this bucket because it's here. We can't make it go away. What are all the benefits? We have a chance to collect data. We have a chance to detect and prevent things earlier. We have a chance to integrate medical data, or to the extent that someone wants to go personal, and be able to take their own through testing, all the new testing. There's blood-based biomarkers. There's new retinal imaging testing. There's our gene testing. There's our nutrient testing. These should, as you said, these should be happening at our doctor's offices. We're testing our heart, but our brain, it is the most vital and important piece of our bodies.
And I
And
think you make the connection between brain and heart because everybody takes care of their heart. And the brain is an organ just like your heart. And what a great message you left us to close on. I hope everyone out there that listens to this will at least ask themselves the question, what could I do? And maybe do something for yourself. Take care of you. Take care of a family member, but care. Sarah, thank you so much for being with me today. I can't wait to see you next month.
I'm
And
so, so grateful. I'm so impassioned. I am so hopeful. This is all of us. This is a moment. This is a movement. This is hopeful. And everybody has a significant part. Tomorrow is the anniversary of losing my husband. We all have a story. And love is more powerful than fear. And we have to just turn the tide of what has been a hopeless moment into real action and promise. And so I'm grateful for the time. I'm grateful for your deep work. This interview should be about you. I'm going to come interview you next because I believe you've done more for this, and your belief in the science and in the investment and the need for public-private partnerships to make this happen is profound. So I'm grateful for your new friendship, and I'm looking forward to all that we'll do together.
me too. Thank you so much. And listeners, please check out the website. It's www.socialimpact.partners. And just Google it. You can get there. Thank you so much. Thanks, Sarah. We'll see you soon.